Good morning, everyone. Welcome. Thank you for joining us this beautiful morning this summer. I am Kathy Greenlee. I am the Assistant Secretary for Aging as well as the Administration for Community Living. I am so glad that you could join us. So my honor to next turn this over to a wonderful guest that we have with us this morning from the White House, Cecilia Munoz. And
Good morning, everybody. Welcome to the White House. We're so excited to have you here. And we're looking forward to a really interesting exchange. And what I appreciate the most about the exchanges that we've been having on the is how much we learn from them and how much we are guided by seeing the world as you see it, seeing the implications of this law as you see it, knowing what you know, and making sure that we're gathering the information that you presented to the process, because it was instrumental in helping us develop the law. It's instrumental in helping us implement the law. This is incredibly important feedback for us. So thank you so much for taking the time to help guide our work. So with that, I'm really looking forward to our conversation, and it falls to me the honor of introducing our wonderful Secretary of Health and Human Services. She was the Insurance Commissioner of the state of Kansas before she became the governor of the state of Kansas, and she knows the healthcare system from every angle, and she has been a forceful advocate for the health needs of Americans for the Affordable Care Act. We are incredibly lucky to have her as our Secretary of Health and Human Services. Ladies and gentlemen, Secretary Kathleen Sebelius.
Well, good morning, everybody, and thank you, Cecilia, not only for those nice comments, but for the great work you do as head of the Domestic Policy Council. I want to recognize and thank our panel members for being a part of this discussion today. Over the past few decades, I think Medicaid has made very good on that promise. We have about 48 million Americans relying on that program, and 11,000 baby boomers a day become eligible for Medicare. We have the biggest group ever in the history of this country coming in on a daily basis as the baby boomers age. And as you've just heard Cecilia mention, thanks to the Affordable Care Act, Medicare is stronger than ever.
Thank you very much. It's always good to have the Secretary with us. We really do want this to be audience participation, and for those of you watching at home, be sure and send in your questions at Seniors Health if you have questions. We also have two people who have microphones who can help with your questions, so they will spread out, and we'll be able to do questions and answers. Do we have a question from this side?
Good morning, Christine. Sequenzia Titus with the American Society of Consultant Pharmacists. We know that consultant pharmacists save a significant amount of money through drug regimen reviews in long-term care facilities, and we wonder how you see their role developing in the interdisciplinary team as the ACA progresses.
I think that one clear goal for the Affordable Care Act is to make sure that we build stronger care coordination activities, that we link the benefits much more closely together with hospital benefits, physician benefits, pharmacy benefits, long-term care benefits, that we know that when providers practice in teams, that care is safer, that care is better coordinated. So a lot of the changes that are in the Affordable Care Act really are around to ensure that healthcare is more integrated, that benefits are brought together. For example, with the wellness visit, one of the elements is to have the physician review the pharmacy medications each year to ensure there's no harmful interactions, and that's consistent to how we want care practice throughout the healthcare delivery system, be it in the physician office setting, the long-term care facility, really to make sure that we avoid bad interactions with medications, and pharmacy benefits are used to keep people healthy for longer periods of time. But that's really the goal that's throughout the Affordable Care Act, is to ensure that data, that interaction, that care coordination is throughout the entire healthcare delivery system.
It's about their health, and those of us know seniors that what seniors want most is to stay healthy and stay independent, and this law can help them do both. So thank you all very much for coming this morning. It was wonderful to have you here.